The first live surgery that we are going to start today would be a phacoemulsification with a ZEISS Trifocal Intraocular Lens, and that is going to be done by Dr. Hemlata Gupta. So the patient is ready. Okay, so this
अब
case
आपको
is
ना
being
3 लाइट्स में देखना है,
done
दिख रही
under
है?
topical.
हल्का
हेमलता
सा
कोएक्सियल पे
illumination
करके
बढ़ा दो।
देख लो, बेटर रहेगा. हेमलता
हाँ जी, जी सर।
कोएक्सियल पे कर. Is this better? Okay, fine. So we are starting. Okay. So Dr. Hemlata, all yours, all the best, and we will start with this procedure now.
A very
Bolo.
good morning to all of you. Am I audible?
Yes, yes, Hemlata.
Yeah, a very good morning to all of you. Thank you, Dr. Mahipal sir, Dr. Namrata ma'am, and the organizers of SAO for giving me this opportunity to show this surgery over here. So here I start. This is a patient who is 65-year-old female. She is a housewife and she has to perform all the activities at all near, intermediate, and distance. So I'll be putting ZEISS trifocal lens in her, and the cataract is grade 2. So here I start. I'll be making my side port incision. So this is the rexis for the all kind of premium IOLs. We want a very well-centered rexis with almost like 5 to 5.5 in size. And here I go with the incision, main incision. Chop. So here I go with the first chop. Please बोलेंगे नहीं अभी 1 मिनट के लिए.
Chop. As you can see, it's a direct chop, and the ease with which she has accomplished the direct chop.
Almost खत्म.
The vacuum is.
Got it.
कितना vacuum?
So I use 450 vacuum.
Yeah,
around
so
450.
vacuum is 450. Aspiration flow rate is 40, and IOP, this is a Centurion machine that is being used, so IOP is about 60. IOP come kar de. If the patient has pain, you can reduce the IOP. Bas. Center kar de. Center.
Epinucleus.
She's
So
gone
here I
on
go
to the
with
epinucleus.
removal. It's almost done.
So Dr.
Lens डालेंगे.
Hemlata, they are saying very fast.
Very fast, Hemlata.
Thank you, ma'am. Now I'll go with the removal of the cortex. So we have to ensure complete cortex removal.
So actually, almost all our surgeons are used to coaxial. They do bimanual in situations, but coaxial is always faster, as we suppose. She is doing capsular polishing now, as you can.
Watch you, sir. That's why they are more used to.
Yeah,
Yeah, we learned everything from sir, so we follow all his steps.
बस हो
बस
गया
अब
लेंस
lens
डालना
डाल
है.
रहे हैं.
So their lens has been loaded. Center कर रहे हैं हम लोग.
So
Center
this
करो.
is the like BlueMix injector. So this is already pre-loaded lens. So this trifocal has a very good like intermediate and near vision.
We
The
have
patients
15 minutes.
we are using
We
this
have 15
trifocal
minutes.
since long, and almost all the patients are spectacle independent. So this is a pre-loaded lens with near at around somewhere around 3.3, and the intermediate is 1.66 at the IOL plane.
No.
And this is compatible with 1.8 millimeter incision, so you don't have to enlarge the incision. This plate haptic
उनको मार्क करके कटाओ.
and goes very smoothly
Gloves
inside the bag,
कुछ और पहन ले.
and they're very stable once it's there in the bag.
So actually we have done a multicentric study of comparing the results up to 1 year with this. As it stood at 1 year, the patient satisfaction level is pretty high, and the intermediate, near and distance vision is all pretty good. The rate of PCO is also pretty low. So I think the results will be out pretty soon, and we will be publishing it. I think the company, so it was a multicentric trial across 15 countries, I think. So Namrata or anybody else, any questions on this surgery? Hello.
Yes. So Vinay wants to make a comment.
Who wants?
Dr. Vinay Garudia.
Yeah, Vinay. Yeah,
I
Vinay.
was just saying, with surgeons like this, do you really need femtocataract in your routine now, sir?
Yeah, now there are old surgeons like Dr. Mahipal who need femtocataract. Okay.
बस हो गया everything.
So anyway, any other question?
बेगम
So ZEISS trifocal lenses, there's a difference.
जोर
I
नहीं
like
लगाएंगे.
synergy. You prefer to do to the first positive.
आप जोर लगा
This is either emetropia or you go to the first
बस.
negative. So that's the slide, and
बेगम
then they have the LISA technology, that is light adaptation. Uh, Anyway, they have smoothed out the steps, so they call that as a LISA technology. This is the lens, and essentially the steps that are there are smoothed out, so you don't have the dysphotopsias that is there. The ad is pretty good. It's a plus. It's actually at 40 centimeters that you have good reading ability. And you get it in the toric variety. There is a hole with which we can put the placement of the plate haptic that is there. Come, Hemlata. Excellent surgery, Dr. Hemlata.
Excellent surgery, Hemlata.
Thank you so much, sir. Thank you, ma'am. And we are using trifocal since long. I think it is a very good lens if you want to get rid of glasses for most of the activity. And it's pupil independent, so scotopic vision is also good. If there is dim light, the light, there's a differential lighting that is there in the IOL. So there is not any drop in vision in dim lighting conditions.
So,
Okay.
sir, you've used so many of these multifocal lenses.
Yeah.
So, and this is a plate haptic design and is different from the other designs which are not plate haptic.
Yeah.
So, do you think that the plate haptic design has some advantage or has an advantage?
So I think the stability of the lens is pretty good. That is the advantage. The disadvantage is the material that is being used. It's a hydrophilic, hydrophobic material, and but as of things stand, around 1 year plus, the stability of the toric has been good. The outcomes have been good, and PCO has been almost similar to a hydrophobic lens. So overall, the dysphotopsias are very significantly less in all the trifocals that have come, and I'm pretty happy with the outcome of the new trifocal variety as compared to the earlier bifocal.
It is really helpful in trifocal toric, because in those cases we don't want any rotational distability. That is very good in plate haptic lenses.
Okay, can we, I'll just go on to the smile surgery in a minute. I'll be there in the other OT, okay?
Okay.
Yeah,
Thank you, everyone.
Thank
Thanks
you,
for
Dr.
being here.
Hemlata.
Thank you. Ma'am, I kept the incision at 2.8, but this IOL is compatible with 1.8 millimeter incision also. So, but I use the keratome as 2.8. That is what we use in the OT routinely. But it goes very smoothly inside, and you don't have to. I mean, you can even do the wound-assisted this thing, the incision.
Lisa, like sir was saying, is an acronym for what? So, 4 unique principles.